officially call this meeting to order. Welcome to a meeting of the Monroe County Board of Health. And I'll start out by everyone introducing themselves. First of all, I'm Kay Leach, and I'm serving as the chair for the Board of Health. Next, I'll ask the board members to introduce themselves. Ashley, you want to start?
My name is Ashley Craner, and I'm the vice chair of the Board of Health currently.
George?
George Hageman, retired microbiologist from IU and member of the board.
Mark?
I'm Mark Norrell. I teach healthcare management and policy at Indiana University. I'm board member.
Steve?
Hi, I'm Steve Pritchard, retired dentist, longtime board member.
Carol?
Carol Tolukian, retired pediatrician, also a longtime board member.
And Bob?
Robert Wren, retired OBGYN physician, been a board member 3 or 4 years.
So that's your board members. Next, I'd like to introduce a person that everybody knows because her name's in the paper daily, and that's the administrator for the health department. Penny?
Good evening, Penny Caudle, administrator for the health department.
And then our health officer or commissioner of health, Dr. Tom Sharp.
Good evening. Yes, this is Tom Sharp, and I'm the retired family practice and commissioner of health.
Dr. Sharp, can we see your face just to know who you are? I know you're sharing an office.
Let's see. Okay.
There you are.
There I am.
Thank you, Dr. Sharp. Penny and Dr. Sharp share in the same office. In order to maintain distance, it's hard for both of them to be on the screen. And then I'd like to introduce our legal representative or consultant, Margie Rice. Margie, I can't see you, but are you there?
I am here. Let's see if you see me now. Do you see me now?
No.
Nope. Okay, hold on. Ta-da!
No,
Okay, hello. I'm Margie Rice. I'm a county attorney, and I am happily assigned to the health department.
Well, we welcome you very much. So
thank you.
Okay, next I would like for you to look at the agenda for a second. I'd like to make a change if it's okay with the board members. Under D as in daily, I'd like to make a number 1, a new number 1. I'd like to make that a public health legislative update. I understand we have a couple of visitors or guests with us today, and they're going to give us an update about the what's going on in public health on the legislative level. So that's number 1, and then the next one, administration, will be number 2, and so forth. Any board members have objection to that? Any board members have any other changes to the agenda that they would like to make? Okay, then next I would like to go into our agenda with public comment. If there's any members of the public that would like to bring an issue or would like to make a comment for the board, I'd like for you to please raise your hand on your screen or make yourself known to our technical support person, Michelle, and please let her know you would like to speak. Michelle, do you see any hands out there?
Looks like 1.
Okay, and that looks like someone named Bill Kreshner. Bill, go ahead.
Yes. Yeah, my name is Bill Kirshner. First of all, I'd like to thank you for the opportunity to speak with you today. I am the House Director at Christian Student Fellowship on 1968 North Jordan Avenue. And what I would like to bring up today is just what was brought to my attention back, I think it was February 2nd or the 8th. I got an email stating that on Greek Row, fraternities and sororities were not allowed to have outdoor or outside guests this semester. And to my knowledge, that is new from the first semester. We did have guests first semester outdoors, and I'm pretty sure that that's something that we talked about as a group throughout the summer preparing for the school year. We had signups outside for any guests that came just so we could do contact tracing. Anyway, my point is I was a little bit frustrated for the students' point. And again, I'm thankful for what you guys do. I'm very, understanding that we're in a very difficult time in the nation and we're all dealing with the pandemic. I believe personally human beings that were made for community, and there are probably guesstimate thousands of students on this campus and throughout other college campuses that feel very disconnected from their friend groups. Not being able to visit outdoors with friends is not good for these college students when it comes to their mental health. Over the past 2 months, positive cases, as you all know, have gone down in Monroe County. They've dropped significantly over the past 2 months from January through March. IU, with the mitigation testing, those numbers are also down at this point. And so I understand and realize that there are concerns over the past year for the county, just with the college students coming back. The concerns are hospitalizations and deaths. It was reported by, I believe, the mayor this week that deaths are down from mid-December 90%, and I'm not sure about hospitalizations. All of the meetings that I attended from the summer on, Dr. Carroll pointed and emphasized very strongly to the IU community of the importance of being outside and doing things outside. And yet we're telling the student organizations in Greek life that they cannot have other members from their houses over to visit outside. I understand that there are risks involved in allowing visitors to come and to visit outside, but each and every one of us are taking risk every day when it comes to this virus. One thing I don't understand is why the housing communities of the Greek that we're not allowed to have these guests outside, but when it comes to the university as a whole, people can have events in open areas around campus, and that's okay. But then when it comes to our own houses for just, and I'm not talking about big events, because obviously we would go through the procedures of the county and the university in submitting requests for those type of events. But I'm talking about people coming over and just hanging out with friends on the front lawns or somewhere there outside. I know the concern is that the regulations will be broken. I can't make promises, obviously, or guarantees that things like that would not be broken. Most likely, though, regulations are being broken somewhere. I do not condone that at all. When it comes to this pandemic, personally, I've taken it very seriously, and we've tried our best here at this house. But again, my concern and my fight is for the students who've had a really difficult year, and it just feels like this is one more thing that they're not able to do. And it's been very difficult when it comes to our situation for recruitment and all other kinds of things. And so I just wanted to bring that to your attention and ask that this committee would, or this board would consider maybe changing that to allowing guests outside. And then possibly if mitigation tests and numbers proven that they've gone up, then maybe you could pull that again. But it's really difficult for me to put that on the students. And again, we're all about following your regulations, and we want to do what's right without a doubt. But it was a very frustrating email for me to get.
Thank you, Bill, for your comments, and we'll be looking at regulations a little bit later in the agenda today.
Thank you.
Anybody else out there? Michelle, do you see anyone else?
I do not.
Okay. We'll go down then to the approval of February 16th meeting minutes. Have all the board members had an opportunity to look at the meeting minutes from February 16th? I did find one correction, and that was on page 2 under community regulations. That very last part of the paragraph, there's one sentence that's down twice. It says the board agrees to require masks while weightlifting. It's repeated twice.
Okay.
There's one little clerical thing as well in the attendance for that meeting on the second line. Insignificant, but
I see it.
what's that?
Your initials,
Thank you. All right.
yes, I did not catch that when we did that. I apologize.
Maybe
I
that
didn't
should be
catch that one either.
Pagey.
Okay, any other corrections?
I would move that we accept the minutes with those 2 corrections.
I'll
Steve's
second.
made a motion. Ashley has seconded. Okay, let's call for the vote. Cranner,
Yes.
Hegeman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Need to unmute, but
Yes, I was muted, sorry.
and I also vote yes. So the motions stand approved as with those minor corrections. Okay, next on our agenda. We're down to public health reports, and today we have 2 visitors with us that are here to talk about public health legislation. So if they would introduce themselves, and I'll turn everything over to them at this time.
And I'm going to actually, oops, hold on. It's Margie. I'm going to actually introduce, hello, I'm going to introduce them. And we have Sydney and Rick with us, who are our lobbyists for Monroe County. Now, Rick is driving, so he's not going to appear on screen. He's going to stay mum. Sydney is going to give us a little bit of a presentation, and I can share my screen if Sydney would like. There are going to be 3 bills that we're going to talk to you about today that we've been watching. I should say we, Sydney and Rick, are really the ones watching them. But it's House Bill 1123, which has a partner in the Senate. That's Senate Bill 407. And Sydney will talk about that. Also, Senate Bill 263, which has to do with local authority over religious services and limiting or putting restrictions on religious services during a declared emergency. And then the last is Senate Bill 5. So I will turn it over to Sydney and let her talk. And Sydney, if at any point you want me to share my screen to give the board a little bit of detail, I've just pulled up the website on the state's website and with the information on this bill. So if you want me to share it, I can. Otherwise, I'm just going to turn it over to you now.
Sydney, you're muted.
Thank you. Margie, I don't think we need to share our screen. I think I can just do a quick synopsis of each bill. And then if you guys have any questions, myself and Rick are happy to answer them. I'll start with Senate Bill 5. This is the Appeal of Local Health Enforcement Actions Bill. This establishes an appeals process before legislative bodies of enforcement actions taken by local boards of health and local health officers. So if a person or a business has, an enforcement action was taken upon them, it just simply creates a procedure which they can appeal that decision or enforcement action on them. All of these bills, I should preface by saying they are being heard in the Rules and Legislative Procedures Committee. And what I'm assuming they're going to do is combine all these bills into one. House Bill 1123 was heard in the Rules and Legislative Procedures Committee, and that was talked about. Since a lot of these are similar in topics, they're probably going to make one large bill, but there's a lot of vetting that needs to be done from various stakeholders and organizations. So I'll move on to House Bill 1123. Like I said, that was heard in the Rules and Legislative Procedures Committee today. That has to do with the states of emergency and General Assembly. So really what that bill is doing is allowing the General Assembly to come into a special session given that a public emergency is declared by the governor. And really their goal for this is just to come to the table and help make decisions along with the executive branch. Like I said, that was heard in the Rules and Legislative Procedures Committee today, and its partner bill, if you will, is Senate Bill 263. Or I'm sorry, Senate Bill 407, and those are similar. That's a similar language. I will say the biggest difference about the two bills is that House Bill 1123 does contain a provision regarding local decisions. So basically, if a county decides to be less restrictive than the governor's executive order, they can do that. But if they want to be, if a local health department decides to be more restrictive, they have to get approval by a county executive or pass it by an ordinance. And so that's the biggest difference. And there was kind of some conversation on that today. They really did not elaborate on that topic. But the bill was held in committee, and that means they're just waiting to hear and vote on it later. So that it hasn't been put back up on the schedule, but I'm assuming the next committee is where they're really going to decide which bill they're going to use and what kind of language they're going to combine and keep. I think the last bill I have that deals with any kind of local health issue is Senate Bill 263, which deals with local authority regarding religious services. House Bill 1123 also touches on this topic, but Senate Bill 263 really focuses on it. Senate Bill 263 prohibits the state and a political subdivision from imposing restrictions on a religious organization that are more restrictive than the restrictions imposed upon other businesses and organizations that provide essential services to the public. There was a lot of discussion around whether or not religious services should be prohibited or can be prohibited. And that's something that the General Assembly will likely keep discussing and make a decision on in the coming weeks. So that's my update. If you have any questions, I'm happy to answer them.
Board members have questions? Ashley?
So can you, why is Senate Bill 263, the religious services being separated out from other organizations and businesses under the House bill and the combined Senate Bill 407? What's the distinction? Why are they separating it out?
Well, and Rick, you can chime in if you want. I think it's on the topic. For example, there's a civil immunity bill this year that really protects businesses from being liable. So there's a lot of bills that are issue specific, and I think they do that so that especially with these local health issues, they're very broad in scope. And I know that religious services is a very big deal in our General Assembly for a lot of members, and so specifying on this topic is probably part of a more narrow scope that they want to focus on.
So could there be a difference in treatment from businesses and other organizations versus the religious services? Could it come down that we would have to treat them differently in terms of, implementing or providing health and safety?
So are you asking if, they, given a scenario that you could shut a business down, but you could not shut a church down?
Yes.
I think there is discussion around whether or not that's appropriate. I cannot speak for any of those members, but there is discussion around whether or not religious services is protected, and whether or not that we have the authority to allow them.
Okay. And then I only had one more question. Sydney, what's your last name, dear?
It's Sheresny.
Can you spell that?
It's CSERESZNYES.
I am so glad I asked you to spell that. Thank you very much, Sydney.
Yes,
That was all from me.
Any other questions for Sydney? Margie, anything you want to add?
I was only going to address Ashley's question. It seems to me, as Sydney pointed out, when I read the legislation, that there seemed to be a definite interest in establishing, hold on to my video, establishing protection around religion. So if you look at the legislation, the sort of digest or summary for Senate Bill 263 says that it permits the state or a political subdivision to require a religious organization to comply with a neutral and generally applicable health, safety, or occupancy requirement to the same extent as other organizations, if the requirement is otherwise allowable under Indiana's religious freedom law. So I think the point is they're trying to carve out protection around religious services and make sure that anything that a local health department would do regarding religion is neutral, and that we aren't treating them differently than businesses. That's my take on it. We'll see how things pan out. I'm sure Sydney and Rick can talk about, how things can change very quickly in the session. But it does seem to me that there have been enough people who have voiced concern to the General Assembly that, will say, oh, you can have, bars open or liquor stores open, but you can't have, church services. That they're definitely trying to protect religious services and make a point by having it in a couple different places. And Sydney, I don't know if you want to comment on that, or Rick, feel free.
I just agree with you, Margie. I think the topic of religion, as you can imagine, is a sensitive topic anyways. And they're really trying to ensure that it's consistent across the board in how we treat businesses and organizations, but also, respecting religious respecting the places of worship. And there was a lot of talk around the Constitution today and whether or not we even had the authority to limit. And I think that's really what they want to nail down as far as the religious worship piece.
I'm sorry, did you say you disagree with Margie? It sounds like you're agreeing that.
No, I agree.
Oh, okay.
If I said disagree, I misspoke. I apologize. Okay. I echo what Margie was saying.
Right. So from our standpoint as a board, I can't imagine, maybe we can look back at some of our regulation and ask this question, but I can't imagine that we as a Board of Health or our health officer would, differentially apply regulation to a religious institution. There's not a scientific basis. But I would ask the question of our health officer or any other Board of Health member whether there's anything that we've done that even hints at something along those lines. If so, I guess what I'm saying is I certainly don't see that this would be any kind of a barrier or problem for us as a Board of Health if that were to pass. But, I would ask the board members to weigh in on that.
Well, I think we treat churches and their ability to congregate based on percentages. They fall under that regulation. And I think what I'm hearing is that the state and the church services feel as though there should be an exception to people that attend. So let's say we're at a 30% or 50% maximum capacity. I think it sounds to me like they're looking for an avenue where they can continue with 100% capacity.
Actually, you kind of.
I don't hear it that way. I hear that it can't.
Okay.
Maybe we want Sydney to weigh in on this, but it sounds to me like we can't impose anything more restrictive than we would on any other organization that's
Well,
not.
that would be less restrictive. To allow a church to have
Can anybody hear me? I'm getting a problem with the sound.
It's okay.
I can hear you. Okay. Yeah.
Okay. Well, if people are fading in and out and I can't hear what they're saying.
So, Sydney, this would prohibit us from imposing anything more restrictive on a religious congregation than any other organization, or do I have that backwards?
So I'm quickly reading through the digest. So it prohibits the state and a political subdivision from imposing restrictions on a religious organization that are more restrictive than the restrictions placed on other businesses that provide essential services. It allows a political subdivision to require a religious organization to comply with a neutral and generally applicable health safety requirement to the same extent. So to the same extent as other organizations. So what they're saying is you cannot be more restrictive. You cannot single churches out. And Representative Lehman, even though we're talking about 263, the topic of religious worship and services came up for 1123 today in committee. And the discussion was that we do not think this is going to happen. There was question of whether or not, well, if we don't think it's going to happen, should it be in law? But that was the discussion that was had. We're ensuring that places of worship are not treated differently in a more restrictive way in these situations.
Is there precedence for that? I mean, do we have counties that are doing that?
It did not, from the testimony that I heard today, again, that was on 1123, that was not. Now there was no example of that happening. But again, and that question did come up, and that question comes up a lot with some, legislation. And it's more so that we just want to make sure in future instances, there's this guideline in place to where, okay, this is what we can and cannot do.
Okay.
And
I would just note that some religions have as services singing choirs. They pass out the host. They have people drinking from the same cup, sipping from the same cup during communion. This is a little different than the average bar or restaurant or certainly emergency services.
So that was actually talked about today. I learned a lot on that subject today, and the consensus was that we would hope that the church would act to the best of their members' interests if it was a public health issue. So it didn't sound like they were going to put any restrictions on those kinds of services and whether the singing but that was talked about, and there were questions raised about that because of the social distancing and the drinking from the same, cup. So the presentation was that we would hope that the churches would act in the best interest of their people. But I'm not sure that there's no guidelines other than what I've laid out here, is diving in further into that.
And if I can add to that, they're definitely trying to create a safe space for religious services where it's almost as if, if you're going to, you can't be more restrictive than you're going to be to another business. And the complaint that I've heard during this pandemic, Penny, you can speak to this, Sydney, maybe you can speak to this, is that certain, liquor stores were able to stay open, as there were certain things that were deemed an essential business while churches had restrictions on them. And that just really infuriated some people. I think that made its way to the General Assembly. And so they're trying to create a safe space for religious services. Now, the thing that I want to point out is think about this piece of legislation along with the appeal process. I'm all for due process. As a lawyer, I understand why due process is necessary. I think the way Senate Bill 5 is written now, if somebody appeals some restriction that the health board puts in place, then it gets kicked up to the county commissioners for an appeal process, and the health board order is stayed until that process works through. So my concern as a lawyer is that we are going to have political processes in play rather than truly having health-minded. The Board of Health is all focused on health issues, and you're going to put it into the hands of a political body. And what you have put in place is going to be on hold until that political body resolves the situation. I don't think this is necessarily ideal. While I am in favor of due process, I don't know that this is necessarily ideal for public health. However, we live in Indiana. Indiana is a conservative state. There are 92 counties. Not all of them are configured or think the way that we do in Monroe County. So, but we're subject to this legislation by the same General Assembly. So I don't think it's anything that this board has done or would ever do, but we are subject to what's going on around the state of Indiana.
Now, I don't know that we can lobby legally. We're a subdivision of government, and we're not supposed to lobby ourselves, right? But would it be within the realm of reality for our board to take a position on this draft legislation that, we would oppose any process that takes authority away from the scientific government branch and puts it in the hands of political officials, that we as a board take that position?
I think certainly that's one reason why we have lobbyists here. Our county hired lobbyists here tonight to hear your feedback. They're going to take feedback and take that back to Indianapolis. So I certainly think you ought to share your thoughts openly with Rick and Sydney. I will leave it to Rick and Sydney to tell us whether they think that would be helpful to them if you would make some sort of formal stance.
To me, this comparison between liquor stores and churches sounds like typical legislator hyperbole. I mean, they're apples and oranges. I mean, one is filled with people singing in some cases and doing mingling and doing all kinds of things or whatever they want to do. And the other is a business with typically doesn't have large crowds in it. But I mean, I'm just using that as an example because that was the example that came up. And the people that are using that hyperbole are the very people that would be making some of those decisions. And it's highly politicized. I agree with you, Mark, 100%. And I know other board members, I see you shaking your head. George was nodding and I was too. Taking away the scientific approach to this is just, that's my biggest fear. I understand they want to protect religious rights. I'm not here to do anything other than that, but still we have to use sound, scientific evidence, do evidence-based things. So, I mean, I just hate it when they do those kinds of comparisons. It just is so disgusting, in my opinion, when those things happen.
Some of the worst incidents of super spreading events have been funerals, the Hasidim in New York, Black churches in the South. Religious contexts can afford some very serious super spreader situations.
I also agree with when public health events happen, sometimes time is of the essence. And if an appeal can put public health measures on hold until the political people get around to doing something, it just doesn't seem appropriate for protecting the public health.
Oh, it's like governing by committee.
It goes against 100 and I don't know how many years, 120 years of sort of precedent about the authority of public health bodies. So,
well, it's against our mission. Our mission is to protect the health of people in Monroe County.
And I agree with Margie. I think it's okay to have appeals process and procedure, but it shouldn't hold up important public health work that needs to be done in the interim.
a related question. What if this discussion was had also at the commissioners level? How do you think that it would help if we ask the commissioners to weigh in on this too? That I would imagine that the commissioners would, at least our commissioners would probably feel the same way, that they would wish to defer that and give that authority. And they probably don't want to retain that authority. At least our Monroe County commissioners don't. Would it help our cause if they weighed in too on this?
I can tell you that as their staff, I'm staffed to help them as well. I'm sharing their feedback, and we have regular conversation between the commissioners through me to to our lobbyist. And you're right. I mean, many our commissioners are not at all interested in superseding your authority, but I can tell you that we tend, as you probably know, we tend to be different thinking than many counties in Indiana. And there are some county commissioners in Indiana who would like to be able to have a little bit more control. So I don't know that we need to have a formal conversation between the Board of Health and the county commissioners, because I think you're on the same page. And I think that's already being shared with the lobbyists. But, Sydney, maybe you can talk about sort of how much time is left in the session, what's going to happen. Not that you have a crystal ball, but, having done this, maybe you guys can talk about sort of what we might expect going forward before things are actually finalized.
Right. So you never know till midnight on the last day what's going to happen. And I think with it being a year where we don't have a lot of access to them, I'm not sure if you are aware of how things are working over there this year, but the public and lobbyists included are not to be over there unless you are testifying, which means we do not have as much face-to-face access to these legislators. I'm sure you've read, the news articles about a lot of the different types of legislation that they want to push this year. And, just to give you some perspective as to what the first part of session looked like, because in the second half, when we just entered the second half last week, 113 bills were, or not 113, 1,013 bills were filed at the beginning of session, and 316 are alive right now. The next deadline, I believe, is April 15th for the House. Mid-April is when the committees have to hear bills by. So if 1123, for example, it was heard in committee but not voted on, and if it is not voted on by mid-April and gotten out of committee, the bill is dead. The following week, so the last week of second to last week of April is when second and third reading deadlines are, and that's when it moves to the floor for a bigger discussion and a final vote. So, I can't say what's going to happen. They've pulled some rabbits out of hats this year, and, things can die at the last minute. I mean, we saw it, we see it every single year. I will say, though, from listening to the Rules and Legislative Procedures Committee today, The General Assembly is dedicated to coming up with a plan for public emergencies. Now, whether or not that's going to include the local provisions on like local authority on what you can and cannot do, I'm not sure. I think the biggest goal that they are trying to reach is establishing a way for the General Assembly to reconvene themselves and call themselves back into session, given that something happens with a public emergency of whatever kind, so that they can work with the executive branch and be at the table in the decision making. I think the consensus from committee today was that they didn't feel like they were, and they want to be a part of that process when you're making statewide decisions, such as the ones the governor had to make last year. I will say the second biggest factor that will probably go into it is the religious services and the religious worship, and what that will look like if statewide restrictions are imposed again. Again, I'm not sure what those are going to look like, but I will say that there was a very robust discussion on the importance of allowing religious worship to happen and whether or not they have the ability to even restrict that at all. I am not a legal expert. I'm here to advocate for clients, so I cannot say, how that will turn out. But I think those two are the biggest goals. I know that the appeal process, that bill does have support, and from a lot of legislators. Again, whether or not it'll pass, I am not sure. It has not been scheduled for a hearing as of yet, but we will see. And I think I said this in the beginning, we're thinking is that they'll combine this into one comprehensive state of emergency, local health enforcement or health enforcement action bill. And once a couple more of these bill, I think so, once Senate Bill 5 is heard in committee, and probably 263, if they both are scheduled, once we get those through committee, they'll probably bring it back together and have a discussion on, okay, what are we going to keep and what are we going to remove? And what is going to go into this final piece of work? And I will say, this committee discussion is very, narrow. You might have 6 to 9 committee members on there, but once it gets to the floor, you either have 50 or 100 people discussing it. And that is a whole different ballgame, and anything can happen. So
I do have a quick question. I mean, have you been reaching out? Because, for them to insert themselves into public health emergency plans, we have those. And we work with emergency management. We work with FEMA. We have all different kinds of public health emergencies that fall under this umbrella. So if we have a massive flood like we did in 2008, where they don't have even a personal physical way to get together to make any votes, but all of these health departments have been working in districts with other counties. We have all of these memorandum of understandings. I mean, like, I just wonder, is natural disasters being included in public health emergencies? Because it's certainly not just COVID related.
You're absolutely right. And let me pull up, and Margie, maybe your legal expertise might be needed here, but so for 1123, for example, it's states of emergencies. And I'm looking, I don't know how they define it for states of emergency. So emergency sessions, Margie, I might have to refer to you on this, and I'm not sure you have the answer.
Let me look. I have the bill pulled up. Let me see if I can find it real quick, if I can see the definition.
But they would have to define that, Ashley. So that's really what I'm getting at, is that they would have to define. I think the goal is for whatever happens. I don't think a public health emergency, and don't quote me, I think Margie will be able to answer this.
Let me look.
But it's a state of emergency, whatever. whatever happens. And, I can't imagine what that might be right now. And a year ago, I don't think I could imagine it being a global health emergency. So I think they're trying to leave that vague. Again, that is really based on the definition. But
yeah. And I can say that, they're calling it situations when the governor declares an emergency. It says, as used in this section, emergency refers to any of the following declared under this chapter: a disaster emergency, an energy emergency, a local disaster emergency. So it's going to be a public health issue. It's going to be a tornado. It's going to be, an energy crisis. So the state, and so it goes on. They're casting a broad net here to really get to any kind of emergency. And let's put it into context as well. We heard early on when the governors started making decisions that the General Assembly was upset, that they felt like he was overreaching. And so we know that we've heard that the General Assembly was going to address what they've heard people saying the governor overstepped, the mayor of Indianapolis overstepped, local boards of health overstepped, and we had certain population, that really felt as if, we were getting into this state of affairs where government was stepping on people's rights. As somebody pointed out earlier in this conversation, and again, I warn you, do not get me started about Supreme Court precedents on local health law, because I will go on for hours. But I will tell you, it's some of the oldest body of law we have, because when these pandemics and health emergencies started, we had state and local government. We did not have a law. We did not have a strong federal government. Early in our country, when there were colonies, it was the local and state governments that were keeping people alive and healthy and safe. And so the body of law that is surrounding public health law is very old, and it is squarely in the, in the court of local and health and state government. Most people don't study that body of law. Most people today who are passing legislation and signing legislation don't understand that, and they've probably not looked back at some of the constitutional issues. So here we are, and this is the legislation that we've got before us. And I think that what's probably going to happen is something's going to get passed. We're going to live with it for a little while. We're going to see how it affects us. There might be some litigation about it. We may have to push back. Who knows where things could go. If you get, if you appeal and you get up to the Supreme Court, guess who does know about that old body of law? Guess who does know how this sort of came to be? And so, we have to just sort of breathe through our noses, see what gets passed, see if it really affects us on a practical level, see if we can still do our work and keep people safe. And if we can't be afraid to push it and litigate and appeal and see if we can make change. And that's my spiel.
This is just an aside, but the next time this comes up, maybe another epidemic.
Very nicely done, Margie. And Sydney did a very nice job educating us too. Appreciate your input. The Board of Health is designed to take care of health, and that's our goal. I think we all agree to that. And we have to put up with the other outside influences.
We really appreciate you coming tonight and talking to us, Sydney, and we wish you luck up there.
And I have to say, we're so grateful that these guys are on our team this year. We've not before had lobbyists. They also represent Lake County and Hamilton County. So it's not as if they're new to county government, and they're just really doing a great job for us. And so I appreciate you guys being here tonight and really appreciate your help.
Yeah, absolutely. And I really have to this is my third year in the lobbying field, and I'm learning a lot. I don't think Rick is on the call, but I'll give all the kudos to him. He ran the Association of Indiana Counties for 10 years and knows county government like the back of his hand. He knows the state house. He's worked in lobbying for almost 40 years. So he he really knows his stuff. So he's the one who educated me, and I'm, we're both here to help, where we can. And, that's part of our job is helping educate on what goes on in that building and, how the process works. So just feel free, Margie, feel free to give out, my contact. And if you guys need anything, any more clarification or anything like that, I'm happy to help out where I can.
Thank you. Okay. Next is administration. Penny, are you out there?
I am. The other bill that I will mention is House Bill 1001, and that's about the cigarette tax. Excuse me. Bug in my throat. Excuse me. And the biggest thing is that it's putting the money in the budget where they can use it for anything, not just health programs. So I'm can we go ahead and let Amy go so I can get my voice back here?
We can do that, Penny.
Thank you.
Okay, next is Amy Meek. Amy?
Hi, good evening.
Hi there.
So for the public health clinic, there are lots of moving parts in terms of COVID vaccine and what's going on there. I'm going to let Penny give you all those updates because there's a lot of that, and she's involved in every part of that. We have hired 2 more nurses to help with staffing. So we have hired 1 full-time RN who's a temporary position. So once the vaccine clinics and outreach is over, that job, then goes away. And then we've also hired a PRN nurse to help with all of that. And the only other part of my report is just kind of update on what we would normally be doing. So normally we would be going into all of the schools right now and helping kids get up to date on their vaccinations. And because we're doing so many COVID clinics, we're not in the schools during the school day for that, but we are working with the schools right now to provide some hours that are after normal business hours or weekend hours so that parents can still get them up to date on vaccines without missing work, and really targeting those 5th graders going into 6th grade, making sure they have all of their up-to-date vaccinations and including that HPV vaccine. That's all that I have.
A question for you, Amy. How's the county doing in terms of the vaccination rates? Has there been any issues with COVID, with it dropping down, or have people actually showing up?
I'm going by memory right now. So our HPV vaccination rate in particular, to be fully vaccinated, I believe our goal was 51%. And last time I checked, I think we're at 48%. So it is down a little bit, but not as bad as I thought it might have been.
And how about early childhood vaccinations? Are those doing okay? Or?
So at our clinic, our vaccination rate has maintained, but we see so few young kids. We really need the state numbers to come out, and they haven't come out yet for our county, because most of those children on our list, there's less than 20 kids.
Okay.
Those age groups are vaccinated at the pediatrician's office, and that hasn't come out.
So you haven't seen the registry numbers?
No.
Oh.
No.
Well, when you get them, I'd love to hear how they're doing.
Okay, I can request them.
Any other questions for Amy? Amy, thank you so much.
You're welcome.
Yes, thank you, Amy.
Penny, are you there now?
I think so. We'll see. This will make me quick, right? Because if I keep losing my voice. So just in terms of staffing, a couple things that I didn't note. As I have told you, we had 2 retirements. Randy Raines from our septic division retired. Last week was his last week. Teresa Benassi in Vital Records, our registrar, is retiring, and next week is her last week. So we've been doing some shifting. Ryan Cushman has been with us for several years now in wastewater, and he will step into Randy's position, has stepped into Randy's position. And then Cheyenne Cox will join us next week, filling that wastewater sanitarian position. And she has been with us for the last 2 years under a SPIA fellowship working in our well project. So we're very pleased to have her join us in full-time employment. We are interviewing for the vacancy that will come up in vital records. So hopefully we'll have those squared away soon. Again, our vaccination clinics are going very, very well. We've vaccinated now over 5,200 people at our convention center site. We are getting ready to transition, as most of you I think know, and to Assembly Hall with a partnership with IU so that we'll have more capacity to expand as vaccine becomes more available. We're also communicating with the National Guard and others that may be able to help us expand if we need and have the capacity to do a true mass vaccination clinic or series of clinics. I think everybody's probably aware that the state was at the Indiana Motor Speedway this past weekend. They did over 16,000 vaccinations. Johnson & Johnson, they have 3 other similar vaccination clinics occurring, one in Sellersburg, one at Notre Dame, and then one in Gary. So as large amounts of vaccines start to come in, and that's what we expect, it's not here yet, we'll be seeing more of those clinics as well as expansion to local health departments and bringing other entities, including businesses, on in terms of vaccinating their employees. So we're anxious to get that going. Thankful for all of our volunteers. Over 770,000 people in Indiana are now fully vaccinated. So we're excited. This is an area that I think Indiana is doing very well. On Monday, teachers and school personnel will become eligible for vaccine, not just through the federal pharmacy program, but at any vaccination site. And the good news for us as a department is next week will be a very stressful week, but we will be moving back to the Health Services Building, and we will be closed. I mentioned this for the public as well. We will close at noon on Thursday and be closed through Monday so that we can make that move and be ready to open up and provide service again on Tuesday. County offices do remain by appointment only, so we're closed to walk-in traffic. Everything is kind of online, through the mail, or by appointment. The metrics, just to kind of very, very quickly, if you look at the advisory map, we are in blue. I don't think I'm going to tell you anything you don't know, but I say it for the public. We are still in yellow when you look at our cases per 100,000. They were 75 this past week. That was a slight uptick from the week before. So we had went from, I think, 115 to 88 to 63, and then back up to 75. So I hope that that's just a little blip and that we'll see another turn down and we'll start on a consistent downward trend for those so that we can hit our goal of having under 10 per 100,000. Again, eligibility, I've talked about those things. Security Pro is on here, I believe. Aaron is here to give us an update in a little bit. Our work with the compliance officers is still going well, and we hope to continue that. If you're willing to continue that, and the commissioners are, that may be very helpful. And the last thing that I have is we ran into a request actually from a pool facility who last year had paid for their pool permit, but ended up not opening. And they asked that they get a refund or essentially apply 2020's fees to 2021. There are several other facilities in that similar situation. And so if the board is agreeable to that, we would like to just apply those fees that were paid but they did not get to open. And I shouldn't say they didn't get to open, they could have, but they did not open, that we would simply apply those to their 2021 permits, and it will amount around $3,000. And I think that's the bulk of what I have.
Well, let's talk about the pool situation. Board members, do I hear a motion that we apply the 2020 payment to 2021?
Was there any expense on the part of the board to do the services we would have provided?
Well, we did process, the payment, but we did not do any inspections. They did not open, so they did not receive any inspections.
Okay.
Good question, Dr. Wren. That was a good question.
I'll second. I think Carol's made the motion to.
Do I hear any motions?
I moved and Steve seconded.
I'll second it.
Okay, we have a motion on the floor and a second. Let's take a vote. Cranner,
Yes.
Egerman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I also vote yes. So the board has voted yes on that motion, Penny.
Great, thank
Penny,
you.
one other thing that was in your on the information I got was something about a birth center.
Oh, and that would be they would like to come and just do a short presentation to you at the April meeting. So that was just kind of an update that they will be coming to the April meeting.
Okay, I think we can go ahead and put them on the agenda. Yeah.
You started to talk about a Senate bill, like when you first got the frog in your throat.
Oh, there is House Bill 1001. It's in the budget bill, but it's about cigarette tax. So there are a lot of public health bills. The interesting thing about this cigarette tax, right now, I think that the cigarette tax is 50 cents. So there is a motion to increase that. But the real point to this particular bill that I think is of note is that by it being in the budget bill, they would be able to use that tax money on anything that they wanted, not just on public health measures. So for instance, with the tax settlement money, that's what funds our local health maintenance fund and the Indiana Trust account, and we have to use it for public health. But this bill, with it being in the budget, they could take that tax money that they get from cigarettes and use it for anything. So just wanted to make you aware of that.
Yeah, the last I read, there was something that earmarked a good chunk of that cigarette tax proposed money for expanding HIP 2.0 eligibility, or no, I'm sorry, expanding or improving reimbursements to physicians who care for those Indiana Medicaid patients. Now, I don't know if that's, maybe I should go back and look in that, but I swear I thought that was an earmarked thing in that.
Yeah, I have to plead a little bit of ignorance, but I think the dilemma is that it is in a budget bill. So it's where it's placed. So they might earmark it for one thing and then move it to something else.
Okay, I'll look into that and let the board members know. But I think I was very encouraged by the idea of having that money go towards improved reimbursement for Medicaid services, because in some cases we have shortages of physicians who will see Medicaid patients. And the more that we can push reimbursement out to those, the more participation from among those physicians we will see in caring for Medicaid patients.
Okay, so Mark, you'll research that and get back to us on it. Okay, anything else, Penny?
No, not at this time.
Okay, next is Security Pro. Aaron, you're there. Give us an update.
So it's been going good. Obviously, the last couple of weeks for us have been tougher because every time the governor changes the color or status of the state, everybody in Monroe County also thinks we change. So usually the first couple of days after the governor changes something, we have to go back in and reiterate to them and kind of correct them that just because the state's changed its status or its color doesn't mean Monroe County has, and that we're still following the same rules that we were, that had applied before, and nothing had changed currently. So it's been interesting, basically the last 4 weeks as the governors came out and changed. And, we get a lot of questions. We've seen a lot of questions here lately. Obviously, Marion County's trying to open some stuff up because of basketball tournament and stuff, I believe. So we're seeing a lot of questions on why we're not following that and everything like that. But we just refer them to Penny and Nicole, and they've been great working with us and working with the restaurants and stuff, explaining to them why Monroe County stayed where they are and what we're doing. So,
Any questions for Aaron? Aaron, thanks for joining us today. And
no problem. Thank you, guys.
Thank you.
doing a great job.
Thank you.
Thank you. Next is underserved population action items. I know in our last board meeting, we asked that there be a report about some of the action items going on for the underserved group.
Right, so Nicole has been spearheading that group, and she's going to give you a little update on the action items that we've been involved in.
Okay, Nicole.
Hello, everybody. So just kind of briefly going into it, our first thing that we've done is we've hired an intern to help with this task force. I need to mute. Hold on 1 second here. I have two things going. Okay, let's try it this way. That's better. I had an echo in my ear. So we have hired an intern who's going to help with compiling data that you all have talked about previously regarding vaccination numbers in some of our underserved populations. So she is currently working on that. She's also available for any other COVID-related tasks or data collection that we have going forward if we have anything that that kind of was open-ended when we talked to her in her interview process. She's also working with a professor over at IU and developing a logic model that's going to help with some of the outreach portion of what we're doing with this group. We have a handout being created in both English and Spanish that is going to have just general vaccination information and data that we can pass out to various community groups that we've identified as the most beneficial to be able to spread it through the community that we needed to go to. We've also handed out an additional flyer that has our current testing site and Moderna information stuff on there with our current vaccination information on there as well. We have decided that the handout that is being developed will initially be posted on social media outlets and distributed to various community groups, including some of those after school programs where some of the children that are there are often I don't want to say caregiver because that's not the right word, but they're the ones who are the communicators for their household, just based on language barriers. I presented at the NAACP meeting last week just to talk about some general vaccination information and COVID information for the community. That was great. We've partnered with some various staff from IU to help reach some different minority groups and underserved population groups within the university. The translation of our COVID portion of the website is going to be underway. We have a volunteer in this group who's going to translate that COVID page for us into Spanish. So if someone is Spanish speaking, they'll be able to click on a link and it'll take all that information and it will be on a different page and it'll be in Spanish. So that's exciting. We are also working on sustainable goals for this group to work on past our coronavirus pandemic. And we are going to use the strategic plan to help and build some of those goals. So if I'm missing anything, I don't know, but I think that's where we're at right now.
Quick question, Nicole.
Yeah.
Because we haven't gotten to the strategic plan yet, but the Board of Health has 2 action items and deliverables, well, participating in a couple deliverables that have to do, one specifically with developing a report and sharing data. So is that something that your intern can start putting like a lens on in terms of, our output to assist the Board of Health in? I attended one of the meetings. I thought there was a lot of really good ideas and there was a lot of volunteering going on. And I was like, oh yeah, I'll have them do that. I'll have them do that. I'll have them do that. That was me. I'm like, oh yeah, I'm gonna have you do that. But I'm wondering if based on the 2, like I said, action items that are in the strategic plan, if that's something that the board, if we can utilize, or how can we utilize the intern, if the data you're collecting, if that's something that we can build on our actionable items that we're required to do?
So any of the data that she's collecting, I will happily pass along to you. And if there's more that you need that to go with that, we can definitely have her look and see if she can get that in there as well.
Okay, I think that would be important because we have, about a year, little over a year to kind of work on this collectively. And I know you don't have your intern that long, but it would be nice to kind of work out those first steps and then so that they're set and we're not recreating the wheel every time we go in. Because I do think this is a really important topic, even outside COVID,
Right. And I think that's kind of where those goals are coming in post-COVID with the group. She is very epi focused. So a lot of the data is number data. So if there's additional information other than that, then that's something that we would have to look at and see if that's something that she's going to be able to compile.
Nicole, how do we reach those people that don't have computer access, that maybe don't have access to or the ability to get the pamphlets and so forth? Are we getting everyone that's underserved?
I'm going to defer to Penny on that because that is outside of this group's focus. There is a group working on that, but it's not this one. So I'm going to defer to Penny on that.
Well, I would say that we probably will never get everyone that's underserved, but that's certainly our goal. Even talking about vaccines, we are building our plans and we're working to get our homebound people vaccinated. As an example, going into the shelters to do vaccinations for unhoused community, and then looking at where those next communities are and how we reach them. So it's part of a larger goal, but I'm not sure that I can say we will 100% always reach everybody who's underserved, but that is certainly the goal.
I think we received some indication, at our last meeting, we had public comment that provided us with good data on the differential in immunization rate and vaccination rates. And I've gotten an indication that of course, what we heard last meeting was that a lot of the supply that we get through the state is already earmarked for those people who have appointments through the state appointment system. And that's what creates a problem. But in my information that I've received, the state health department is aware that that is creating a problem, the way that that appointment system works. And there's an office at the state, I forget what the name of it is, but it's like it's an office of equity, or I forget. But they're aware that the problem exists, and I understand that they're working on a better way to allocate so that that gives us the latitude to be able to do that, to get some extra vaccine and do things like that. So it's kind of like, again, we're sort of back to what was said at our last meeting in February.
Yeah, and this is, again, one of the reasons that we like the partnership and being able to move to to Assembly Hall and to have that partnership with IU, because it will free up some of our staff to do those outreach. And we've gotten a very small amount of Johnson & Johnson that we're using, again, as I mentioned, kind of to finish up those homebound for some of our shelters that need vaccine. So we've got a plan for using that and getting that out to individuals. I will say that, as troublesome as the scheduling system can be and has been for some people, Indiana has done a much better job at getting vaccine out to people, and the scheduling is one of them. We hear every week, I get comments from people that have either went through our system or a parent or somebody else has, and they reference other states and their long lines, no appointments, standing in line for hours, being there for hours, getting up to the front of the line, and then there's no vaccine, or just standing there for 3 or 4 hours and then being told there's no vaccine. The benefit to having the appointments is that people know that when they have that appointment and they show up, they're going to get vaccinated. And so it is definitely not the perfect system. I am not here to sing its praises on how it works, but it definitely, Indiana has done a better job than most. And there are lots of plans and things in the work, and not only at the local level, but I think at the state level, in terms of how we reach people who may be hesitant for the vaccine, people who can't get to us, all of those different things. So it all in progress, but I'll tell you what, everything changes every day, and this has moved so fast. There's not a lot of opportunity for a lot of advanced preparation. It's kind of, you're in it, make it happen.
Right, and that appointment system was built for efficiency, just to get the maximum number of doses out to the maximum number. It was not built for equity, And I think that's maybe what they're sort of, now we've got the efficiency taken care of. Now we need to go back and think about equity.
On the screen, I see a hand up for Leslie Fazzoni. Leslie, do you have a question?
No, I do not. I'm sorry if there was a hand up. I'm not. That would have been an accident.
Okay. All right. Anything else on the underserved? Okay, next is we are going down to old and continuing business and regulation discussion.
And I think that this can be relatively quick, but I know that we have people from the university on here who've been waiting, and we have people from the Greek houses that have shared some of their concerns that are waiting for the discussion. So I would, if you don't mind, like to just start with kind of talking a little bit about the communal regulations. And I will go through kind of where we've been, and then yesterday, last night, Dr. Talukian and I joined Dr. Reister and Dr. Fazzone and Dr. DeBibo and Dr. Carroll in a conversation with residents in some of our Greek houses. And so they had lots of questions, and I just kind of want to go through these. I don't know that there's lots to change tonight, but I do know there is lots of concern about guests, and I will kind of go there. So we've had conversations about occupancy I think everyone understands that occupancy is not changing currently, but there, as we talked about at the last meeting, there's concerns about occupancy for the fall. Our advice after our conversation last meeting is that houses should plan for 75% capacity, just as what's in the current regulations. Plan for what they might do if they had the ability to increase that. So you have kind of a best case and a worst case scenario, but you start with 75%. There is a lot of conversation as guidance is changing on people who are fully vaccinated, that there may be, I think it may be too soon to say tonight, but certainly in the coming weeks, maybe there will be an opportunity to provide some more leniency, a small increase in capacity if everybody's fully vaccinated. So maybe that would be an opportunity for them. We talked a little bit, one thing that I will say in terms of shared dining and living facilities, I think that that's going pretty well. In terms of houses right now, if they are seeing some infection or they go to quarantine, we have kind of a scale up approach so that they go to 25% capacity if they're in what we call yellow, and then they go to that delivery and kind of carry out to-go meals if they are actually quarantined. I think that that seems to be working, and I don't think we've had a lot of complaints about that. I don't think I've had any this term about that. We talked about sleeping rooms last time. I don't think that there's a big issue there. The real concern comes with the guest policies. And the regulations do say that they may not have non-essential guests. So they can have, you know, if they need a repair person to come in or something like that, then certainly they need to keep track of who those individuals are and when they're there, but they could come in. We talked at the last meeting, again, to kind of clarify for people that when we talk about a facility, it's the whole facility or property, but it is coming up again. It's spring, you know, spring is coming and people are wanting to gather. I think that IU may be looking at this kind of internally as well. Some of the concerns with guests is maintaining that limit. The city has a maximum visitor limit that would be 15. How do they do that? How do you ensure that they're not then coming into the house? Those kinds of things. So I'll let you talk about that in a minute. I will say we've had some questions about tours. And we did have one official request, Dr. Sharp. We talked with them, set up some criteria for them, and we're allowing them to have that tour given those specific set of criteria. And I think we will write that out. And again, for others that submit that request, we would consider those with similar circumstance. So the question really comes to what your thoughts are on the guest policy. And I think Dr. DeBebo may be able to talk about that very well too from the infectious disease standpoint, and others from IU may have comments that they want to make before we have further discussion.
I'd just like to add that, you know, it was a really interesting discussion last night. And I think the concerns that the students have are legitimate for sure. And especially with vaccination coming up, and how is that really going to change what their behavior and their living situation should be? For right now, however, I mean, we still don't know about we still have variants out there that may cause problems. Even though our rates are down, they're sort of plateauing, and our county is doing remarkably well, but some of the counties around us where people are going to be traveling in the very near future because of the big NCAA tournament coming, I think we need to be very vigilant about that. So I think that the concerns about people getting together at this point, and the reason that we've done well is because we have regulations, and I don't see at this point until we get through spring break and the NCAA tournament and people coming into town that anything really needs to change right now. But I think we need to think about what's going to happen in the fall, particularly if people get completely vaccinated. And I think that's one thing that we need to encourage is that if a house is fully vaccinated, I think they can certainly have more leeway. But I think at this point, we can't say anything more about planning for the fall semester because we don't know. And we don't really know how long vaccination is going to last at this point.
Yeah, I would have to agree with you, Carol. And I think that I would just hope that Bill would just be patient with us and have good faith in the sense that, we meet currently. We talk often and we're reviewing this more often than not. And we want to see the kids get back to school and to get back to socializing and having all of those kind of activities that's part of going to college and just part of being 18 years old or 14 years old, any of them. But I think that right now, I'm certainly as a board member and part of this team, I'm not willing to forego anything that we've got going on right now. I think it's too early to say. But I just hope that he and the rest of the Greek houses understand or believe in us, that we hear them. We want everybody to get back safely also. And time will tell, but it's a little early for us to just kind of say, hey, you can have 50 people in your front yard when the city still won't allow it,
The other thing about housing too, which I failed to mention, is that they still need to maintain isolation and quarantine rooms. So so that you can't be at 100, they can't be at 100% capacity because they need to isolate a certain number of rooms for isolation, because at this point we're still going strong. I mean, COVID's still out there and we have variants coming and the state's opening up, and so we're in good position for another surge coming here. So in terms of just the occupancy, even for next year, I think we have to safely assume they can't be at 100% because they still need to have isolation rooms.
I agree.
Dr. D. Bilbo, is there anything you'd like to add or say to the board?
I think Dr. Lukin summarized our conversation yesterday and summarized the current evidence for infectious disease very, very nicely. I think the one thing I would say is the light at the end of the tunnel is here. I think we're just not there, but it's not going to be like this forever. And I do agree with her that the reason why things are starting to look good is because of the restrictions. And with our student population that we're talking about not being vaccinated yet, we fear that there might be risk for recurrent surges as we have seen in the past, and that we are in the last stretch before vaccinations. So we're getting there, and we definitely understand people's frustration. I think everybody's ready to be done with this.
I certainly am.
Leslie, anything you want to add? Thank you.
Sure. Yeah, I think the one thing I'll add is we've received a number of questions about whether or not the university will be requiring vaccinations, and so that decision has not been made yet. But I think certainly for the board to consider, or what might the houses want to consider regarding requiring vaccinations for their residents, that's certainly some of the conversations that we will have with our groups, since they can have their own oversight for those students as well. Overall, I think our students are doing a really good job. Our rates are low across the university, so just want to recognize the great work that they're doing. I think we are testing our students living in the Greek and student organization houses, as well as the residence halls, twice a week. And then generally all of their students have been tested about once a week. And so I think that's been incredibly effective. We've only had 2 houses quarantined this semester. Actually, I think it's been 3, but we have 0 currently quarantined as of now. And the metrics that were developed by the county health department, as health administrator Penny, in partnership with some of our public health experts at IU, have been pretty effective and helpful. And so appreciate that partnership as well.
Thank you. Kathy, anything you want to add?
I am just thankful for our continued work and collaboration together. I think Leslie and Dr. DeBibo have said it all. Thank you.
Thank you. I'd like to ask our health officer if he'll say something about what we heard about earlier about the students meeting with guests outside?
Well, I have no problem with it if they're outside, and but the problem is when they come in. If they're outside and you know, I have no problem with that. It's just social distancing and masks when it's appropriate, and unless somebody has something else to say about that. I mean, they can meet anywhere else on campus. They're not invited in PRN. I mean, they can't just wander into the house because they're there. So, but I understand that Christian fellowship group was meeting all last semester. That's what I was heard, and now they're just wanting elucidation. They want to hear that it's okay, I guess. That's as near as I can tell. But meeting outside is always okay, you know, and especially with a 0.1% positivity rate. You know, I mean, there's virtually none going around right now, and there's no spring break, so they don't have a chance to go get more. But the people in the house are the ones that are at risk. If they get sloppy with their visitors, they're the ones that are going to suffer. So they need to be paying attention. And we have.
Can I ask Dr. Sharp, where are we at with the city in terms of what because I know a lot of the city was this kind of outside gathering, was it not? I mean, we don't want to say, you know, it's all fine and dandy, and then we have a party of 75 people out front of a Greek house when the city has their own gathering restrictions set as it is.
Well,
yeah, I think we need to be clear what we're saying here today, Dr. Sharp. I think we need to make sure that this message is clear, because I see a question already. Does it mean that we're able to meet outside at our Greek house?
Yeah, for as much, yeah.
Well, there are still limitations, you know, within our limitations. We have, only so many people can be there, and that changes from time to time, but we're going to, you know, we're in blue. And so it's always about doing it safely or not safely, you know? So,
So from last summer to your last meeting, when we discussed this, and last summer, the regulation was the same. It is your facility is your property. So you're not supposed to have guests. So certainly they could go off their property and have guests. There is a city limit of 15 as a gathering. So if there are 50 people living in the house, they're residents of the house, and they could certainly gather in the yard all they want. But if they brought 15, you know, if they brought 15 or 20 people, and you can think if a house has 50 members, they're in the yard and they bring 15, the police or whoever, or the neighbors don't know necessarily at what point they are over that limit. Just to kind of clarify that, but from the beginning, when we put these regulations in place, that what the message was that your property is your facility and you may not have guests. So if you want to change that, we do need to be very clear. Either you can have guests on the property, you know, is it just inside the house? Is it in the yard? Is it on the whole property? And at our last meeting, you did say the whole property.
And I still feel that way personally for today. As of today, I still feel that way personally.
I think the reason we came up with that regulation is we had instances where there was a large gathering, a large party on the lawn, and it started all kinds of problems. So
city has a limit of 15, so they can't do too much.
But if you add 15 guests with the people who live in the house, that comes up to a fairly good sized number.
Okay, well, we're not saying 15 plus 15, we're saying 15 total. So, but you know, I see this more as in having somebody over, sit down and have a talk, and not an official, not a party and not a free for all, but I mean, they're coming outside their house and having a conversation with a person or two. I don't know. You tell me. What do you think? I see nothing wrong with that. That falls totally within our rules. And again, our rules are 25 but the city's 15. And they're the ones that police the campus. We don't do that. We don't police their 15 limit either. That's their problem. That's what they have decided, and we have not decided that.
Yeah, I hear you and Penny saying two different things. I hear Penny saying that outside is part of the facility and you can't have guests, and I hear you, Tom, saying that it's outside, so it's okay. So I think we need to clarify this.
Okay, we are kind of saying, but what she's saying is from before, and what I'm saying is everything. I mean, we do all kinds of things outside, from 100-person pods at football games to, I mean, we're talking about 15 people maximum outside a house. And the transmission outside a house is like zero. Got to have some science here to make some sense out of this, because just saying that inside or outside the houses are the same, they're not the same. Nor is the risk the same.
No, they're not the same. But right now the rule is the same. And I would feel more comfortable if the Greek houses were limited at any given time to having 15 or less people outside as well as inside right now. That's just kind of the given for today. In a week or two, 2 weeks with more vaccinations and more data as we continue to progress, then sure, maybe the mayor and us, you two can sit down and talk about, making it 30 people outside, but Penny, you were right, Dr. Sharp, about talking about the policing aspect of it. And I think for the Greek houses, that just keeping it as simple as we can for them right now is the best thing we can do.
I agree with that.
And the rule right now is for the city, the mayor said 15, and we certainly don't want to exceed that inside the house. So that's kind of where I'm at on it.
Well, I'm totally with that. The question is whether they can have any guests, as what I thought I was hearing. Outside, you can have guests outside. I don't have a problem with that. There's no reason not to have guests up to 15 outside. That falls totally.
So we need to change our regulation to reflect that.
If that's what you want to do, you need to change your regulation.
I'd like to hear from IU on their thoughts on this. Dr. DeBilbo, I'm going to ask you again.
So I don't know that, so for sure outdoors is less risky than indoors, but from a perspective of, we're talking about nothing has changed right now. We still have a group of people that are completely unvaccinated. We already had 3 houses go into quarantine because we know that these houses, once one infection goes in, if they flare up, all of a sudden, half of the house is infected. So we are not yet in the green as compared to what we're seeing, all the people getting vaccinated that are older. We are not in a safe spot with this population at this point to say that, yes, we are, safe going back and starting to de-escalate some of the measures. So this is my worry, is that there's a house with 50 people and we're trying to limit to 15 outside. And how is that going to be policed? Are people going to go inside, use the bathroom, interact with another 50 people? So I think from an ideas perspective, yes, but whether it's going to be feasible in these houses that are completely vulnerable at this point, this is where I raise the question.
Yeah, I agree. I think part of the concern is that congregate housing, as you said, is inherently a bad situation. I mean, in terms of limiting spread of disease, and it's just an unfortunate situation. And and since we're doing so well, I really just hate to do something that'll rock the boat. And also it's very difficult to enforce as well.
Yeah, I'm not advocating about going inside. I'm advocating that if you want to have somebody meet you outside and sit and have a chat with 6 feet of distancing and or masks, I just don't see a problem with that. That goes along with everything else.
That's not what our regulation says, and I'm not sure how we write a regulation to say what you just said.
Well, here is the only other thing. You meet again on April 6th. So it is possible to, keep things the way they are, monitor the numbers and make a more confirmed decision about that at your April meeting. Or you can make a decision to change it tonight. So, or not.
I'm not comfortable.
I'm clear on what.
changing.
Okay, I'm with you right now too, Kay. I think I've spoken my piece on it.
I'd like to jump in as the lawyer. So one thing we always have to keep in mind is that we are not being arbitrary or capricious. So we need to make sure that we are treating similar groups similarly. If there's a reason, a legitimate health reason, a science reason to treat one group differently than the other, then you state what that reason is and you can write your rules differently. And so I want to make sure that if you're going to treat Greek houses in terms of outside restrictions differently than you would treat other groups on campus that would gather together, if you're going to treat them differently, we have to explain why and what's the reason. And I think Dr. DeBebo mentioned that there are flare-ups in Greek units, that there's a tendency to sort of go into the house, that the party can creep inside. Whatever the reason is, let's make sure we make a very clear record as to if we're going to treat them differently. And I'm not necessarily advocating we are, that's your decision. But if you're going to treat them differently than you would another group, let's just explain why. And there may very well be great reasons to do it. Let's just be really clear about what the reasons are and why we would do that. Keep in mind, I'd like to remind you, we are not, this group, Monroe County, does not enforce the city's rules. We recognize them, we don't enforce them. So think about all those things as you're making your decisions today. Please let the university, other university people weigh in because they have a lot of information about this population. And then let's make a decision. And I would advocate for very quickly meeting again to revisit it, to watch your numbers. I mean, if there is an absolute risk or a risk you can identify to having, restrictions on Greek houses in the outdoors, then let's talk about what that is and make sure it's in the record. If there's not a risk that you can identify that is any different than another group, then maybe you don't have stricter regulations. So just talk about that and let's make sure that we've got a real good record going forward.
Margie, are you suggesting that we are? Because I don't feel like we're creating different regulations for the Greek houses than what are actually just set forth for the general population.
Yeah, no, I want to make sure that if you are, if you are going to have anything different than, just the sort of general outside restrictions that are, and remember that Greek house, it's very specific in our regulation that Greek houses are like private gatherings, not like commercial gatherings. So they're residential. And I don't know, Penny, if you want to flash those up on the screen, the draft that we have, if you want to flash on the screen for them to see. I want to make sure I noticed a question in the chat. Somebody said, so are we allowed to have guests outside our Greek houses on our property? Is there a limit to this? And I want to make sure that, we are addressing that and that we're really clear about what it is we're doing and why we're doing it.
Let me tell you that what they do is that they'll go outside and there'll be I don't know, 10, 12, 15 people playing catch with a football or whatever they were doing. I saw this at the ATO house last weekend or within the last week. Okay, how do you know how is somebody going to go up there and say, okay, I want to see everybody's membership card for this house? Why don't we just stick with 15 that we can count them? If they get too many, we can see that. And that's the city's problem, not ours anyway.
Well, our regulations, I do want to be clear, our regulations is that, so right now on this, it's regulations of the city of Bloomington has imposed a gathering size limit of no more than 15 people. Any communal living facility within the city's subject to Bloomington limitation on gathering size. Monroe County's gathering size limit shall stay in force at 50, but that's a gathering size limit. Our communal living did not allow for guests, and that's really the discussion. We've kind of taken on this morphing of how many people can gather, which is not in our, really not the issue. It's whether or not they can have guests in the house and on their property. What we have, the board will continue to prohibit non-essential guests, including members of the facilities organization who are not currently slated to live in the facility. Essential guests are those who are providing a professional service to the facility. Guest logs shall be maintained. Each facility shall adhere to the gathering sizes and all the board's regulations. Virtual gatherings are highly encouraged and recommended.
We have a current regulation that we're dealing with. Has anybody heard anything that makes you feel that regulation should be changed today?
So Penny, so what I did, so it basically said the facility, right? It doesn't say the outside part.
It says facility, and we had this discussion at the last meeting, if you remember, that I asked, is the facility, because we had considered it in the fall, just sort of the facility is inside and out, it's your property. If you want to say that the facility is the house and it's not the yard, that's your prerogative, but that would be the question is, can we clarify it for everybody in what you mean? At the last meeting, our discussion said, yes, the whole property is the facility.
There's a big difference between inside and outside.
No, I agree. I think, being outside, I mean, I don't have any issues with people being outside in small groups, as long as they're socially distanced, and if they're wearing a mask. I have no issues with that whatsoever.
Right. Okay.
Absolutely none.
And this is people coming to visit them, right?
But who's going to police it?
And that's the real issue. And
nobody's going to police it either way. Either way, nobody's going to go up and ask us 20 guys, do you all live here? Nobody's going to do that. The city has not done that at all. And that's their rule. And it's inside the city limits. So,
but the city has, though. I mean, they've been called numerous times about gatherings outside and parties.
Yeah, with the big loud parties, absolutely. But we're talking about guys throwing a football outside and just standing around talking. That's what I saw at the ATO house. I don't think it's the ATO house now, but it used to be the ATO house. I don't know what it is now.
So we're going to meet, we're meeting in 4 weeks, right?
April 6th is your next scheduled meeting.
So less than 4 weeks.
Mm-hmm.
Okay.
I don't care what you guys decide. I'm just telling you that from a medical standpoint, and Bob, I think you would agree that when you're outside, we're just talking about different things. There's still social distancing. There's still masks. There's,
But when's March Madness?
Next weekend, the 19th to the 22nd, somewhere in that date range. I don't have a calendar to know the exact dates.
Okay. Well, I mean, I think the kids are going to do what they're going to do regardless of what they want to do during March Madness. I think we need to do what we think is best for the groups. And I don't know if, I guess I would rather like see some things written down and think about it more collectively. And I prefer to be more cautious with March Madness coming up and not go changing the rules and allowing them to have more, I guess, right now, because I want, I have kids. And then by the time we meet, there'll be some more numbers in April. I'm just thinking out loud here, guys. Because I certainly want the students to enjoy themselves, but we do have a potential super spreader event coming up in communal housing pretty soon. So that would just be something I would suggest that my fellow board members consider.
Let me say that that's all going to be inside, and I agree. You get too many people inside, that's a problem, especially for a 3-hour game or whatever, or a series of games. That can be a problem. But again, we're not talking about inside or out. We're talking about outside's different. It's the concentration of anything is greatly diminished.
And to verify that, didn't Lana say that the people that had the guests come in the house, everybody got infected? There's no reference to any science about outside guests. Am I correct, Dr. Debo?
Sorry, I just wanted to clarify that what I meant was it wasn't the guest that brought the infection. What I meant was the houses are still susceptible to infection to the point where we had 3 already houses, even with this low numbers in the community. We've had 3 houses have been in quarantine in the past few weeks because of a flare of infection there. And I think I was just highlighting the susceptibility of those houses to getting large numbers of infections. So even though we are seeing, good numbers that are making us feel good about it in the outside world, these houses, unfortunately, not because of the people that live in them or anything that they're doing wrong, it's just the fact that there are such high numbers of people living in the houses, the way they are designed, is putting them at risk. So one person introduces an infection, one guest comes in, introduces an infection, you see the whole house, just light on fire with infections, one after the other, and then we're trying to stop it, and it's hard for us to, even after they do everything right, it's already too late. I think that's what I was highlighting with the difficulty. Obviously not blaming the guests, but the guests actually add a layer of complexity.
Right, and what struck me about your statement was, a guest is going to come in and use the restroom regardless of what we say. It's just that's what's going to happen. So I fall on the side of let's stick with the current plan.
Meaning what?
Yeah, I mean, I'm at every meeting, and I am now confused about what we're going to do, what they're allowed to do. So here's what I think is what's going to happen. We have considered the facility. All right. Now I've heard two perspectives on that. All right, that we could gather indoors or they could gather outdoors. All right, that's one. The other one is that they can't gather outdoors because they have a limit of 15 and they are in the city limits. So what is it?
What is what?
What's the current regulation?
Well, what is the limit? Is it 15 people outdoors, or is it the people who live in the facility? Are they allowed to be outdoors?
The people who live in the facility are allowed to be outdoors.
All at one time?
Guests.
Okay.
I think the issue on the table is whether you want to allow guests outside if you want to change the communal living regulations to allow guests outside up to 15. I think that's the issue. And I would want you to specifically hear from people at IU to see how they think that would impact. And I hear Dr. Bibibo saying that she's a little worried about that. But I do want, I think that's the issue. Penny, you tell me if you think that's the issue. Can the regulation be changed to no guests inside, but can guests be outside, essentially up to the 15 limit? But Penny, tell me if you think that's the issue or not, or if I'm confusing it.
No, I think you summarized it very well.
If I don't think the regulation says anything about inside or out, if that's the definition we made, I don't think we have to change the regulation. We just have to decide what the definition of facility is.
Right.
Keep in mind, we'd rather have them outside than inside, and you know what compliance looks like. And these people, which is not good in a few situations. So I don't care how you do this. I'm just telling you, there's no good reason why people can't be outside. These people go all over the place. They could get COVID anywhere. And
I think they should. Yeah, I think they should be allowed to be outside of their own facility. The question is, are we allowing guests or not allowing guests? And it sounds like due to the current evidence, doesn't sound like that guests would be a good idea.
Who's going to use the restroom if you're guests?
Does anybody from IU want to weigh in?
Yeah, I think the one thing that I would add, and I appreciate your discussion on this, and certainly the outside pieces, is I think there is a difference between having like 10 guests over outside and having to use the restroom and the environment of where that, there's some places that are closer to commercial places to use the restroom. So I think that's one piece of like, are guests going to inevitably have to come inside to use the restroom? And then is that a slippery slope where more guests will come inside? But I would say, like, if there's one or two visitors, what does that look like? But if you are to allow this, then a group should have an accountability plan or a process set up, I think would be my recommendation. So what does that accountability from the house or the organization look like? Just what are the expectations? And I think that some groups have done that pretty well with some of their requests. Not that, and I know that there's limited resources from the county health department to review those. So if that is something you do want to allow, then I think there should be expectations around communication, education, and accountability to limit the spread. But I do get this, I do think it's hard that when students are over there on the property, in each organization, accountability processes within the groups are different and do vary, that it is a slippery slope to having more guests in the facility.
And I would like to add that I think the point on this is the accountability piece as well, because I think that somehow if you would move forward with this, making it super clear on what you mean, what a guest means. So we're not talking about having large gatherings, but to someone said this earlier, once you have, like, if the house has like 50 or 60 people and you add in 15 guests, all of a sudden it really starts to look like a large gathering. And while I know the county doesn't patrol that, I mean, our IUPD on campus gets calls on things like that all the time. They're getting called because there's like loud music coming from a house and there's men playing basketball in their backyard, and they're not violating anything, but they're getting those calls and answering those calls. So they are, those calls are coming to us, and this will make it more challenging for IUPD to answer that and determine, are they really violating the ordinance or not. So I think the way that you write this and your clarity on that is super important if you're going to make a change, so that people realize what we're talking about is, if I live in the house and I want to have a friend come over, we can meet outside and hang out on the grass and talk. It's not like you're having a big party in your backyard and having all your members plus 15 people. I mean, that there's a difference between that, and I know it will be hard to distinguish, but somehow making that clear, I think, would be really important, because it's also going to be then hard for those of us who have to hold people accountable if it looks like there's violations, to be able to do it without some clarity.
Penny?
Yes.
Oh, I'm sorry, your light came on. Did you have something you wanted to say?
Nope. I was just waiting for you.
I was just hoping you had some words of wisdom there.
I don't. I realize that it's a quandary for everybody, and I certainly understand these students wanting to have more normalcy and have guests. I think, from the public health standpoint and the concern and from everything in terms of how we monitor it, how we, how it is, what the accountability is, all of those pieces are just very difficult. We know that every time any regulation, it doesn't matter if it's about COVID or not, we always struggle with, there's probably a better way to write that the next time, right? And find flaws and make corrections. I think we just need to be able to give these students clarity. And I know that I think we're all a little confused too, but to be able to provide some clarity, even if it's clarity for tonight, and then, we look at it and try to come up with what that might look like in the next couple of weeks so that there is accountability and clear measures in place, and that could be addressed at the next meeting. Could be another option to just say no guests for now, and let's come up with a way to allow those guests. That could be a possibility. If we can't come up with if you can't, come up with some clear feelings about where you all are on this tonight, then I would say staying where you are tonight and then coming up with some clear guidance. Maybe a couple of you could work on that, in the next week, and we could work with that with Margie and Dr. Sharp to really come up with some clarifications and be able to provide those at the next meeting.
And I want to make sure that we read what comments are in the chat and we address these, because if we don't address them now, they're going to come up later. So let's talk about it. And the chats are coming. So let me just read this to people so that we can talk about it and have a conversation here. So, hold on. The question is, hold on. What is the difference between a guest going in the bathroom at a restaurant and a guest using the bathroom in our houses? We just want to hang out with 15 of our friends outside and get fresh air. I don't understand how a bar or restaurant can run near 100% capacity, where thousands of people are coming in and out throughout the night, but Greek life cannot have 15 guests in their backyard. It does not make sense. Somebody else says, I think it's important to recognize that we are organizations asking for permission and waiting until the permission is granted. We're also very frustrated because we know that some organizations are not asking for permission or waiting for permission to be granted and just doing whatever they want anyway, because as a member of the board said earlier, it isn't being policed. So another comment, pushing this off to figure out how to write this clearly is slowing or shaving weeks and weeks off of our college experience. Please remember that. Now, I think every member has access to those comments. I'm happy to read them as they come in, but I do think that the board has to policing is, it's a very legitimate concern. I don't necessarily think it's this board's concern to worry about policing. This board's concern is to worry about the science and the health and what regulations you need to put in place to keep people healthy and safe. Not that we won't then work with our partners in the community and our partners at IU in order to try our best to enforce these regulations and keep people safe. We certainly will do that. I just don't want the Board of Health to start thinking put your police hat on or your enforcement hat on, because that's not what your role is. And I want you to make decisions based from your perspective as, from science and what makes sense. And if you're going to draw distinctions, that they be based on science. based on fact. I hear the members from IU about the confusion, and I believe me, I know that that will be a real issue, and we're going to have to work through that if this board changes the rules. But I do not want the Board of Health to start making decisions based on you're wearing somebody else's hat. You have to make decisions for what you think is right.
From a practical point of view, you have to realize that we have to stick by the current regulations, but tell the people up front, in the future, we're going to open the door once we see the numbers come down, once we get the data that's correct. So give them a little positive message at the end of our regulations that this is a temporary situation until we get further data, more vaccinations, the data comes back, we're going to open the door to more visitors and so forth and so on. So don't make it so concrete and so negative right now, just make it temporary with the opening of the door coming down the future. That's how I would approach it.
How about, I don't think anyone here is concerned about 2 or 3 people sitting outside, socially distanced, having a chat on the lawn. No one's concerned about 6 guys playing basketball. We're talking about very small groups here. Well, maybe there's something in between that we can do right now, like say limit to 4 people that can gather outside. Maybe not forget about the 15 thing, but maybe because there really isn't anything wrong with, from a scientific standpoint, for a couple friends that sit on the lawn and chat for a while.
But Carol, I don't think that's the issue.
No, that is not. But that's not the issue. But I agree with you. But my point is that it's really difficult for. I think it's really difficult for a lot of these students because they feel very constrained. And granted, they can go take a walk down the street in a group, and that's not a problem. They just So
I honestly don't think that the Board of Health has an issue with the people that are living in the houses, sitting outside in small groups. I really don't think that's what's being asked. When I'm reading James's statements, he's looking to us to not ruin or slow down the college experience. And that isn't 4 people sitting on a stoop. Sorry, James. But I don't think we're disallowing I don't think the way the restrictions are written, the way the city is, we're not disallowing them to have their friends come over and sit on a bench in their yard. We're not disallowing that. What we are not interested in opening up is allowing the college experience of the big parties out front, and being able to go in and out. And I just am not sure. That's not the rule. We're not here to ruin somebody's experience or make their experience, spectacular during March Madness and the last of their senior year. We really want to keep things consistent, in my opinion. I graduated when I was 32. I didn't have a college experience ever. So I just want people to be healthy. And I don't think that we are currently disallowing people to throw a football in their front yard. I don't think what our rules are disallowing that. And then, so James just wrote, we're asking to have up to 15 guests. So then there comes is it the whole house having 15 guests, James? Or is it one person having 15 guests and another person having 15 guests? I'm not really clear on that. I think things are fine at each house. So inside and outside.
So let me ask.
James, can you come on? Does James have?
Yeah, and let me ask you a question. Is the issue the number of maximum people allowed outside? So whether that is a member of the house or a guest of the house, if you're outside, do you want to set a maximum number of people to get beyond any lawn or Is that the issue? Because I heard Dr. Sharp say earlier that that it's outside is much safer than inside. We obviously don't want to drive down 3rd Street and see a raging party of people closely assembled without masks, knowing that these people are largely unvaccinated. But is the Board of Health comfortable saying, if I drove down 3rd Street and I saw this number of people on a lawn at any given time, that I'm okay with that? It's outdoors. What is the, you know, if there are 80 people in a house and they have 15 guests, we have 95 people. At my alarm people, they're all unvaccinated. So,
Dr.
you know,
Blablo, can you speak to that? If you drove by down Greek Lane, what are you thinking?
So you're talking about 15 additional people to the 80.
Yes.
Yeah. Well, let me clear up. I think if we drove down and we saw 95 people on a lawn, we would all be alarmed if we knew that 95 people on that lawn are not vaccinated. They're going to be close proximity. My thought is, my question to you, what number would you be comfortable with driving down and seeing on a lawn?
Scientifically.
I mean,
not just being comfortable with.
I'm not sure that the number absolute is the right thing. I think, I mean, there's a lot there. It has to do with, are they distant? Are they distant? Are they, you know, are they, you know, having safe outdoor interactions by still saying space? I think that absolute number is very hard to point a finger to. Like, you know, 40 versus 45 versus 15 versus 20. That there's no science behind it. What the science is, you know, you have to be distant even if you're outdoors. You can't be close just because you're outdoors. It doesn't mean that that risk goes away. And then the other thing that is scientific is the more people you add, the more risk that you are introducing an infection with the person. So every person carries a certain risk of infection. If you have 2 people, that risk is low. But when you start adding more and more people, you are doubling and actually more than doubling that risk every time you add a person. So yeah, I don't think I can give a number, but the more is not better here.
What we need to keep in mind is if there are 15 people, those are not going to be 15 guests. That's going to be 10 people living in the house, or 12, and maybe a guest or 2 or 3. So we're not really talking about 15 guests. We're talking about a total of 15 people. And we don't really have much to say about that because the city says 15 is the number that could be assembled, which does not mean you do not. I mean, you still have to distance, you still have to mask, but the city says 15. So and it's 15 total outside. Guests plus people there. So we're not talking about the whole house bringing in 15 people. We're talking about 15 people on the lawn throwing a football or whatever they're doing. So that's where I come from, and there is virtually no risk in that. I mean, we're talking about, and don't forget, there are thousands of mitigation tests. They're doing those all the time, and that's the people in the fraternities and sororities know how inconvenient that is to go on quarantine. That's really a pain in the rear. So I don't know. Whatever we say here is not going to make a whole lot of difference. They're going to do what they want to do, as you know. But you know, the city says 15. I'm not sure why we would want to mess with a total of 15. That's very restrictive. Very restrictive.
So I remember being in college. I did go to college as a teenager, and you know, and I remember being in a sorority, and I remember spring in a sorority, and that, you know, as soon as, you know, the weather gets nice, you want to be outside, and you want to be outside with your friends, and that really is part of college life, for people of that age, and I think that as Dr. Sharp said, I see very low risk of very small groups outside. I mean. If we can make a number and say you can't have more than 5 people gather. I mean, we can make it any number we want. We can change it. we're not stuck with 15. If people aren't comfortable with 15 people hanging around on the lawn, we could make it 5 people hanging on the lawn. I really think that it's not a reasonable request to be able to hang out outside with a friend when the weather's nice in the spring. I just don't think that's a big request. And I think we should make it very, very clear that no one goes inside even to go to the bathroom. That inside guests are a completely different issue, and there's no leeway on that whatsoever.
I agree with that, Carol.
But outside in smaller groups, I mean, because they can go someplace else on campus to do the same thing. So I don't see the issue with doing it outside their house, as long as it's very clear that they can't go inside. And I do think that, and I agree with James. So I think that is part of college life, and I remember it very clearly, even though it was a very, very long time ago. That was part of the fun of spring on IU's campus. I mean, we really enjoyed those sort of things, and I think that there's some significant mental health issues that have been going on with all the stress with this year, and it's a very small thing we can do that might, as Dr. Wren said, something to look forward to that you could actually do that you haven't been able to do. And again, if you want to limit it to 5 instead of 15, whatever. But it doesn't require change. It really doesn't, unless you want to add that. It doesn't require change in regulation. It just means defining the facility as the actual building, not the lawn. We don't actually have to change anything to do that. We just have to change what our definition of facility is.
When I was in college, Carol, we had to go outside because electricity hadn't been invented yet.
Well, that was a long time ago, wasn't it?
Can we put a motion on the table and let the chips fall where they may in that regard, that we would allow gatherings on the property, on the lawn, of no more than 15, either guests or residents, and require that the guests stay out of the house?
Well, I thought we would have to redefine what facility meant.
Yeah, and that as well, that we redefine the facility as being the house and not the grounds around it.
And that's actually not in the regulation. That's just a definition we decided on. So
right, but that would be helpful to just clarify that if the issue is no guests in the house, then let's say no guests in the house and make that clear if you're okay with guests outside. I think, and that's what I think. I mean, they're wanting to have the guests, but.
And also to make sure socially distanced, and if not, masked. I mean, I think that the masks and social distance is still part of our health control.
Absolutely.
Mark, I heard a motion. Would you restate that, please?
I would move that we change the regulations to allow no more than 15 individuals on the property, either as a combination of residents or guests, but no more than 15, socially distanced, not allowed inside the building, and that we redefine the property as being inside the building, not the grounds around it.
And that these rules are temporary until we get further data and more information on vaccination. Well, you don't want to put a what if on there.
Well, that's inherent in everything. Like, everything that we do is temporary. So I don't know that we need to necessarily add that.
I'll just tell them I had another.
Doesn't make it look like we're meeting. Data when it comes along.
I understand Aaron from security wanted to make a comment, and he's not on my screen, so I didn't see it. Aaron, are you there? I don't hear him either. So Mark has made. There he is.
Can you hear me?
Yes, we can, Aaron.
Okay.
Aaron?
What was that?
Did you want to add something to the discussion?
No, I mean, we see large groups of
we see large groups of college students every night at the bars and establishments. And, you know, not one way or another, but I do know that once and if alcohol is involved, it does get tougher to monitor the group sizes. Even at the local establishments, the tables will start to try to pull together, you know, and we've got 10 top limits, you know, so we'll see people try to pull up chairs to tables and stuff. So it's going to be tough for you guys. I mean, this is a tough one for you guys to try to work through, but it's tough in the restaurants right now. So I can only imagine what it's going to be like on the outside.
Thank you. Mark made a motion. Does anybody want to second it?
Can you tell us what the motion actually was again, Mark? I'm sorry.
I'm not sure I remember it or understand it.
Okay, so the motion is to allow gathering sizes to be consistent with the city, which is 15 people, whether that is a combination of the residents or guests. It doesn't matter. On the property, it would be capped at 15, so long as those individuals are adhering to public health guidelines in the pandemic, such as social distancing and masks. And the guests are, as they currently are, not allowed inside the building.
For any reason.
For any reason.
Now, may I make a question or ask a question and clarify? Penny, currently, I think the way the regulations are, the House members could be outside in a number that would exceed 15, correct?
Correct.
So this will, in fact, as the motion is presented, would limit and restrict the houses more than they are now, because as it stands now, the members who all live together can be outside in whatever, you know, numbers. The whole house can go outside together because they live together.
That's kind of why I was suggesting that we leave things as they are.
I think that would require us to withdraw that motion then, because that just doesn't make sense.
No, I think that there's a lot to think about here, more so than just, you know, allowing the kids to, you know, play outside, and we want everybody to be outside. I think it's a little bit more complicated than, you know,
So
3
Mark,
hours into this meeting.
I'm sorry, Ashley, but Margie, how can that be if the city has a limit of 15? Like, that is more restrictive than what you're saying.
Well, as I said, I'm not sure that the city's been enforcing that 15, but let me tell you this. You know that in your regulations, you've already delegated to Penny and to Dr. Sharp the ability to adjust regulations if they think it's, you know, you've delegated that authority to them. So certainly if you wanted to punt this very difficult conversation to them, you could. Penny, Dr. Sharp. I will say that, and they do a very good job of working with the university. I hear the concerns from the university about sort of letting up. This again is a population of people that are unvaccinated. That is a definite thing to point to that is different than maybe the general population who's getting vaccinated pretty quickly. I also think that it's possible that exceptions could, could be made on a case-by-case basis if there were some, and Penny, you'd have to weigh in here, if that were something that you wanted to entertain requests that maybe, you know, from a practical standpoint, might be difficult. So you might want to weigh in, Penny, and Dr. Sharp, you might want to weigh in on whether you think that you could use your delegated authority to deal with these issues, taking into account all of the comments made by IU staff, made by the Board of Health members, and maybe keep the regulations as they are, and then, you know, use your delegated authority to make some decision. I don't know what you think about that, Penny.
Well, I will say that Dr. Sharp had to step out, so he had to leave. I mean, we can certainly do that and have some consultation. You know, In terms of asking for some sort of exemption for guests, I think that that is honestly putting beyond our capacity at the health department to manage. I don't know how we would do that. What I keep hearing, and I have sent, and I just got confirmation. So the household, when we talk about gathering limits, you are talking about a social gathering. It is not members of the household. So whether you have a household of 10 or whether you have a household of 50, that's a household. When we talk about social gatherings, it's people kind of outside your household gathering, right? To me, the big issue here is simply whether or not you will allow guests to come to the house outside of the house. You've been very clear that you do not want guests inside the house for any reason, unless they fit that definition. So the question is really, are you okay with them being having guests on the property? Once, in terms of the city's limits, once they hit 15 extra people outside their household, they would be at the max for the city gathering size limit. And you're right, you can't, there's no way for a passerby to ascertain when you're in violation and when you're not. If you want to punt it to Dr. Sharp and I, we can further consult and come up with something in the next few days.
I think that's what most of these people are asking for is, I mean, that's their biggest concern is not being allowed to have any guests outside and simply limiting to a gathering of 15. But if a household is considered 50, then they can have 15 additional guests. Is that correct? I mean, that's what you're saying?
In terms of social gathering, and I'm communicating with the city right now to try, that's their order. So, you know, it's hard for me to specify. So I'm communicating with them now.
In that case, I think that's satisfy. I mean, not that, I mean, I understand we're here to present good public health policy. We're not here to satisfy other people, but I think that's what they would like to do, which would make some people happy, which I'd always like to make people happy too, if it follows good governance and good science. So I guess it just comes right down to, are we going to allow guests outside or not?
No, we could just say that, you know, to comply with the city, when guests are present outside, there can be no gatherings, including the members larger than 15 people. Does that fix the problem? What do you think, Margie?
Can you repeat that one more time?
So we could say that when guests are present outside, there could be no gatherings larger than 15 people, including members of the household. That gets by, because 50 members can be outside if it's just members. But if guests are present, then
well, you got 50 girls in a house, and I mean, and everybody wants to have a friend over. I mean, that's
what I just said. That I just said we can say when guests are present, there can be no more than 15 people gathering outside.
Can I clarify one piece? I don't know if this is helpful or not, but in our university recognized housing policy, we have a COVID-19 addendum that outlines that all of our student organizations must abide by city, state, and county regulations. And so just as so part of our policy through our, I mean, obviously this is not what you would regulate, but part of our policy we would still communicate those expectations all together to our organizations around the 15 person limit. So I think if you do focus on, can they have guests outside the property? Absolutely not, inside, and make a decision there. We will still communicate all of those policies to the organizations because they are required to follow all of them. Kathy, you may want to chime in there if you need more clarification.
You're muted, Kathy.
I mean, what Leslie said is correct. And then I think we also have the IU event policy, which any gathering over 25 people has to go through approval. So, I mean, that would also come into play if they were trying to do kind of an official gathering, and we would probably guide them towards that if they were starting to get larger, just because of all of the things that you all have talked about.
You know, I think it might make sense to have the record show that the Board of Health considered this idea of making a distinction between guests outside and guests inside, knowing that you still do not want to have any guests inside, and that you delegate to Penny and Dr. Sharp to work with Indiana University officials to propose a rule regarding outside guests and any limitations on outside guests and when that may be appropriate. And then they can work on that, and they can perhaps roll something out between now and your next Board of Health meeting, or if not, definitely have something prepared for your next Board of Health meeting, knowing that you have delegated the authority to them, that if they do come up with a rule that satisfies the university and satisfies Dr. Sharp and Penny, that they have the authority to put that in place between now and the next meeting.
And I support that, Margie.
I would agree with that too.
I
would like to make Margie's statement a motion if possible.
Dr. Eigenman.
Do we even need a motion for that? Because that's not doing anything different than what's already delegated, is it? Other than us saying that, well, I think, I'm not sure it needs a motion. Does it, Margie?
No, I think if the board wants to affirm that they support working towards some sort of perhaps a rule about outside guests.
Right. Okay. That's a good affirmation motion. I like that. So, George.
Go ahead.
So I so move.
I'll second that.
George, could you restate that one more time, please?
I wanted to affirm the motion that Margie Rice made, and I'm afraid I can't render it word for word, but essentially it is to allow the collaboration of Penny and Dr. Sharp to modify our position and IU with regard to our position regarding outside the fraternity house on the facilities of a communal facility for guests, number of guests.
And I second that.
Well, I'm not sure we needed the motion, but we have a motion on the floor and we have a second to it. Penny, do you think we needed the motion since it's already there? Should we vote on it? Margie?
You have to.
Yeah.
I think you can go ahead and vote on it. It can't hurt to have a vote on it.
No.
Okay, we'll vote on it. Cranner?
Yes.
Hageman?
Yes.
Norrell?
Yes.
Pritchard?
Yes.
Talukian?
Yes.
Wren?
Yes.
And I will vote yes, and I thank you, George, very much. Okay.
All right.
Next item of business is the strategic plan approval.
No, it's actually the community health regulations.
Oh my.
Oh, okay. I thought we were done with regulations. Community health regulations. Who's that, Penny?
And Michelle, is it possible that you can pull up that draft that Margie did, and hopefully we can get through this quickly?
Yes, give me just one moment.
That's fine. I'll do an intro while you're doing that. So with the changes, it was late fall when it was July, and then it was late fall when we made kind of changes to the regulations. And then we had some sort of intermittent changes, kind of health order regulations. And we just really, at this point, wanted to try to come up with a more streamlined and kind of clarify everything. And before I get going to folks from IU, thank you so very much for sticking with us. And you are free to go and watch IU play. Sorry, I sit still too long. But thank you very much, and we will be in touch. So we really just wanted to kind of clarify a few things in this order and update it so that there's a little less confusion. So hopefully I'll be able to get through it. We are suggesting whatever you approve tonight, any changes would go into effect on Monday, and that would just give us a chance to actually make any final edits that we need to make, give people notice before it actually takes effect. So that's pretty self-explanatory. Oh, that's not the right one, Michelle. The one Margie sent from today, if you have it, from March, labeled March 15th. If not, I'll just kind of go through it. The second, in terms of masks, so when we go through, of course, Margie did a little of her normal wording in terms of new variants. The reason that we're changing things but not easing everything is because of new variants. Vaccinations are underway. We recognize that. And we continue to allow Dr. Sharp to change restrictions if we need to for something that might be occurring. The second line had started, paragraph 2, with our mask requirements. The CDC.
Hey, Penny.
Yes.
What was the name of it again?
It was Monroe County Public Health Regulation, updated to take effect March 15th. I think we sent several versions today. So
if you allow me to share my screen, I can pull it up.
There you go.
Yeah, Margie, you can share your screen.
Okay, great. Thank you. I'm not in a place where I can do that. So
I think this should be the one.
There we go. There we go. Okay, so the date she added in light of the fact that the pandemic continues. When we go to number 2, that's really where we were talking about the mask mandate. And the CDC has come out with new guidance for people who are fully vaccinated. And we wanted to recognize that because originally we had talked about even if you're in your home or somebody else's home, you need to be masked, you need to be distanced. And so we wanted to recognize that they may follow the Center for Disease Control Prevention guidelines regarding vaccinated people. So if they're fully vaccinated, then they could follow those guidance. But unless an exception is stated below, all individuals must wear a face shield, face covering, or mask referred to. So all of that is the same, except that we added and recognized that if people are fully vaccinated, they may gather in their own home with other people who are vaccinated or follow those CDC guidelines. So I think that was really the only piece there. Margie, if you feel like I'm neglecting something, let me know. But again, we just wanted to recognize that change in guidance. In 3, I don't have any changes. That was looking at exemptions to mask wearing. I didn't have any changes in 4, all business and accommodations, nor did I have changes in 5, which is what everybody should be doing in general. In 6, there were no changes. This allows schools to follow, we recommend that they follow the Indiana Department of Education, the Indiana Department of Health, CDC guidelines, and the State Health Department meets with schools really weekly. We're on those calls as well to update guidance for them, and we want them to follow that guidance. So when we came to number 7, again, I don't have any changes there. The changes come with 8. And this is, it's going to go to gathering sizes as well. And right now, we are at 50, indoors or outdoors. If you recall in the fall, we had a gathering size limit for social gatherings, personal gatherings of 50. And if you were in a commercial venue, you were renting a space, then you could go to 100 for inside and 150 outside. And then when we went to Orange, we dropped everything down to 25. And then we recently added back and made it 50. Over the course of several months, the governor's executive orders have also merged social gatherings and events and made them more of the same instead of having them separated as they once were. So we wanted to clear up that our gathering size limits right now are 50 people. That's what's enforced, and that's non-commercial events, gatherings held, personal residences, so forth. We also include that the city of Bloomington may have a different gathering size limit, and that they enforce that. The county does not enforce the city's executive order. The question for you tonight is, would you, and this kind of goes along with what you were talking about, we've had a lot of starting to get requests for outdoor events and in our exemptions. So we can, if you want, add a gathering held outside in a commercial venue, could have as many as 50 people, or it could, excuse me, that's indoor commercial gatherings would still be at 50. But outdoor commercial gatherings could be as high as 100. Now, one possibility is to not make any change to that gathering size, just clarify that it's 50 at the moment. We could make sure that our numbers, our cases per 100,000, continue on a downward trend over the next couple weeks. And in April, when you meet, you could consider raising those outdoor events at that time. Did I totally confuse you with that? So we have right now a gathering size limit of 50. It covers indoor, outdoor, personal, or commercial locations. Do you want
this is with appropriate physical distancing?
Yes, yes, yes. The masking, the distancing all stays in place. So the question would be, would you like tonight to stay where we are with 50 or increase outdoor commercial events? So commercial venues, I'm renting this event space outside, can I have more people? Or do you want to hold off and make that decision at your April meeting? Do we want to talk about these one at a time, or do you?
What's the recommendation of the health officer?
Well, he is not here. I know that he has expressed that he's okay with going to 100. I will tell you that the city, the mayor would like us to not make any changes, no increase at all. He would have preferred us to stay at 25. I have not heard specifically from other people that we work with in terms of if they have concerns about that or not.
Is there much demand for having larger gatherings outside?
Well, we have regular exemption requests, weddings, but there are people starting to plan events, runs, those kinds of things are coming up. The weather's getting nicer. And so people are starting to ask for that. And again, that's one reason I said, if you want, we can wait for the April meeting for that. Maybe have more definitive downward trend numbers to be able to look at that. That would certainly make sense to me. But we did want to pose that to you tonight because that is things that we're getting requests for.
I think based on our last conversation that we wait until the next meeting and get more data. I mean, that's my suggestion.
Make a motion of that and I'll second it, Ashley.
Okay. Well, I'll make a motion that we postpone any changes. I think that would be the motion, correct, Penny?
Yeah, to the gathering.
To the gathering numbers. We're going to make a motion to postpone any changes to the gathering numbers until next month when we've received more data.
So and to clarify then, indoor, outdoor, commercial and non-commercial will be 50.
Okay.
Okay. Then when we talked about restaurant and bars, and this may be something that you also
do we need to second that one or?
I'm sorry.
We have a motion made. Do we have a second?
Second.
Let's do a vote. Cranner,
Yes.
Hageman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I think that makes sense. I'm going to vote yes, since we're having a major event occurring before then.
Yes.
Yes.
Then,
okay, Penny.
Yeah, then, and the next one that always comes up, obviously, is restaurants and bars, and they want bar top seating. We've talked about that before. Again, I would recommend, and Dr. Sharp is not a favor of bar top service, so I will say that the state has allowed bar top service, people distanced, all of those other things in place. The state has allowed bar top seating and service for several months now. Dr. Sharp is still not a favor of that, but we did want to bring it to you for discussion. I think our recommendation tonight would be that you consider it, but probably also make a decision on that at your April meeting as well, when to go along with that. But the thought is to allow that bar top service. Certainly our numbers are coming down, but we are not fully blue yet. Our cases per 100,000, again, are still in that moderate level.
Didn't we go up 12 cases this last
We
week?
did. We did.
Penny, do we have a local expert about the bipolar ionization stuff that could come answer questions to the board next month when we consider all this?
Sure, and we did send that report, right?
I did see it, yeah.
Yeah, Margie, we could probably ask him to present, don't you think?
Yes, absolutely.
I find it really fascinating. I know the courthouse is using it. And, if this would be a way to, and even Greek houses, there's lots of applicable uses I can see for this. But I think I have a lot of questions. I'm just kind of curious about it. But so that's my one question about it. But I know you got to vote. You got to vote on you got to vote. So
We're entering a dangerous time, and I think we ought to postpone the decision about bar top service with or without other precautions until next meeting.
I second that.
I agree.
You have a motion and a second. Cranner,
Yes.
Hageman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I will vote yes.
And the last two things I think will be fairly easy as well. So in our last order, we had said there shall be no self-service buffet style food in restaurants if the county is in yellow, orange, or red status. Staff may serve patrons in a cafeteria-style fashion when in yellow. Even when in blue status, and the board recommends limiting self-service and buffet-style food service in order to limit exposure. So that is an addition to, would be that you would recommend they not have buffets. You know, in our previous order, we said that they could have it if they were in blue, and we are in blue. So it's a decision on, are you okay with just adding the recommendation that they not have buffets?
As opposed to waiting another month?
Well, technically, currently, our order would not prohibit it anyway. So this is just making a statement that you're recommending they not.
Versus they have to.
Well, they would never have to.
Okay. Okay.
But it's just being clear that we don't advise it.
Okay.
I mean, I suppose you could say that you're not going to allow it yet, but.
I move that we adopt the statement which recommends limiting self-service and buffet-style food service at this time.
We have a motion. Do we have a second?
Second. Is that Dr. Salukian?
Yeah.
Yes. Cranner?
Yes.
Hegeman?
Yes.
Norrell?
Yes.
Pritchard?
Yes.
Salukian?
Yes.
Wren?
Yes.
And I will also vote yes.
Okay. And the last piece is already in here, so it's really nothing that I think you need to vote on unless Margie thinks otherwise. When we had went to Orange, Dr. Sharp put in effect that bars had to close at 1 a.m. Instead of their 3 a.m. And then when we went back to yellow just recently, he did just a week or so ago, put that back to 2 a.m. So it's just putting that in this order. It's just kind of streamlining it. So I don't think that there would be a motion. That's where we currently are. So it would keep it at 2 a.m.
Yeah. Okay.
I think we designated that authority.
Yes. Yeah.
Yeah.
So that's not a change, just kind of making that clear. And so,
right.
Margie, I think
That's
I got
clear.
all of the changes. Did I?
Margie, are you there?
He's muted.
Oh.
Sorry, I was trying to find my unmute button. Yeah, I think that you don't need to vote on that. And Penny, I think you did catch everything.
Okay, great.
Thanks, Margie.
Okay, tried to make that short
Good job, Penny.
and sweet.
Why you're Woman of the Year.
Yeah, right. Okay, so then I think that's it, except for hopefully your approval of the strategic plan.
I move we accept the strategic plan.
I'm so sorry, it was put at the end. Okay, we have a motion about the strategic plan.
second
Have all
that.
the board members been able to review it?
It's beautiful.
Yes, it's lovely. The pictures are
I would
outstanding.
ask for a 2-hour presentation from Penny on the strategic plan.
I'll second that.
Nice job.
I immediately withdraw that motion.
Do we want any discussion about the strategic plan at this time?
No, we just want to vote.
We just want to
If
vote.
I can, just give me 1 second. This is a really, really comprehensive, detailed strategic plan that has so much in it. And my only fear is that, here it comes at this time. This is a huge lift for this department. There is so much in here. And that's all I have to say is to recognize that this is a big deal and that's going to be a big lift. So thanks.
And I'd also like to recognize we've been pre-approved, right, for an epidemiologist position to come on and help us with this plan. and other positions. And as overwhelming as it all has been with COVID, I have all the confidence in this board and our department, and the ongoing partnerships that Penny's been developing with IU to, you know, see us through. And Mark, your work on it should not be underappreciated at all. I really appreciate the work you've put in. It's evident, and I think we're all the better for you being part of the team. So thank you for stepping up.
And also there's work for us to do.
There is. I'm looking forward to it.
Okay, I heard a motion to approve the strategic plan.
I'll second it.
I
Second.
I beat you, Stephen.
No, you didn't.
I did.
No, I second
All right.
Carol right away.
You can have it.
We'll give it.
You can have it.
Okay, we're going to vote at this time.
All right.
Kramer,
Yes.
Hegeman,
Yes.
Norrell,
Yes.
Pritchard,
Yes.
Talukian,
Yes.
Wren,
Yes.
and I vote yes also. So the
Yay.
strategic plan is approved. And now we need to figure out how we're going to go to work.
Well, we'll
Not
figure it out.
tonight, not tonight.
We have the Woman of the Year to help guide us.
Yeah, congratulations to Penny for getting the Woman of the Year. We want to bring that up.
I'm going to call her that all the time.
Thank you, Ashley.
Yeah. Your next meeting was scheduled kind of our regular April meeting for April 6th. It would be at 5:30 normally. Is that
Sounds good.
Okay.
Unless you want to do it
Can I get a
earlier.
calendar
I'm
reminder?
okay with earlier. Because
Yeah, so
You want to do it earlier?
long meetings.
Yeah, 4 o'clock's good, Penny.
I like 4 o'clock. Let's do 4 o'clock.
Okay, let's don't jump because we're ready to go. Let's everybody make sure April the 6th is okay.
4 o'clock.
It's perfect.
And at 4 o'clock. Is
That works.
everybody okay with that?
That works for me.
Got it.
Penny, can I get a
Okay, our
calendar
next
invite?
meeting will be April the 6th at 4 o'clock, and we are hereby adjourned.
We have a
Thank
lot of
you
work
all.
till then.